Many people drink alcohol, but addiction is marked by the inability to stop drinking, even when it causes harm to the persons themselves, with work, family, or even their life. Dr. Mary Berst from Sovereign Health reveals the complexities of treating alcohol addiction.
Alcohol addiction is unique because it's socially acceptable. When you meet a friend for a cocktail hour, a happy hour, we have a whole hour or 2 hours in most restaurants that's dedicated to socialization around alcohol. Nobody thinks another thing about if you have 1, 2, 3 drinks. We wake up in the middle of the night sweating, we think of waking up in the middle of the night with a headache. Well, that's part of what happens with alcohol addiction. Our bodies get used to it and then try to detoxify from it as we sleep in the middle of the night. But we don't consider it an addiction. Makes it unique.
Alcohol addiction is extremely difficult to treat, first of all, because most people don't know they have it. Once they do get to that point where they've admitted they're an alcoholic and they need help, it's pretty late in the game. Their bodies have broken down, their spirit, their thought process, coupled with the fact that alcohol's environmentally around everywhere. Once they leave treatment, it's dangerous. They think they get it. The scariest thing we ever hear a patient say is, "I got this under control now." You know, that's scary because then they go out 30, 40 days later, they think they can have one drink, and that ends up killing some of them. That's why it's frightening.
I was addicted to alcohol from the time I was 26 till hopefully 6 weeks ago. I ended up losing my marriage. I lost a couple jobs, and well-paying jobs, and started contemplating suicide and got very, very, very depressed. They start off as your best friend, but it ends up your worst enemy.
Oftentimes, treatment for alcohol addiction can involve inpatient care, which helps the person more directly examine their relationship to alcohol.
We find that an inpatient treatment is most important because we can take that patient, keep them safe, keep them away from family, friends, the environment where they're used to abusing alcohol. It gives them 30 days, whatever time, but it gives them some space and some opportunity for the body to heal, for the mind to kind of relax, to get the clinical care that's necessary to find out why they develop these habits to begin with.
A surprising fact of alcohol abuse is the toll it takes on the body, sometimes with deadly results.
One of the things that happens with alcohol, which many people don't know, is that alcohol is probably one of the leading causes of death. People that are coming off of high doses of alcohol, let's say a person gets up in the morning, has to have a shot to keep the hand tremors from going. A person has to take a shot throughout the day to make sure that they can think right, all this stuff. Well, that's detoxing. Seizures, heart failure, death occur from alcohol detox.
Developing a treatment plan for alcoholism involves assessing the person's physical and mental health.
First of all, let's take care of your body. Let's get you to a medical doctor and we'll see what kind of damage has occurred and what treatment is prescribed to get the body healed. Secondly, let's look at the mind and the thought process. That's why we go to our clinicians, our psychologists, our therapists. We develop a plan to create different thinking patterns and habits so you can choose a better decision next time a drink shows up on your table. These are the benefits of an inpatient treatment setting.
When you go into an inpatient setting, you're not only given the tools to learn how to not do those habits, not do those same routines, but you're given medications that aid your body in processing the detox. So you don't go through the tremors, you don't throw your guts up every morning, you don't have all of the other physiological symptoms that so often accompany that detox process.
I'm doing fine, wonderful. I haven't felt this good since I was 16. And that's the honest to God truth. I haven't felt this good since I was 16. It feels like, a mountain has been lifted up off my shoulders.
We can't tell anybody to stop drinking. What we can show them is how to get through a day without and why that would be positive or beneficial. Everybody knows a drink feels good that first one, but what if you can't have that? Then what? What we try to do is show them that there are different ways to live. It's like a diabetic. Once you start treating that diabetes, you have to treat it every day if you want to live a happy, successful life.